Hashimoto's is one of the most common autoimmune disorders in women, and it is the leading cause of hypothyroidism. Understanding this condition is no longer just a medical step. It's a necessity for any woman experiencing unexplained symptoms or sudden changes in her energy, health, or lifestyle. Talking about Hashimoto's is not a medical luxury. It is essential awareness that helps you understand your body, your health decisions, and how to navigate symptoms you might mistake for fatigue, stress, or other hormonal issues. That's why we will start with a clear and direct explanation of everything related to Hashimoto's, from causes and mechanisms to disease management, nutrition, required tests, and the factors that may accelerate or slow its progression. Hashimoto's is defined as an autoimmune disorder in which the immune system begins producing antibodies that target thyroid cells, causing gradual damage. The result is a decline in thyroid hormone production over time, leading to a wide range of symptoms. This process may take years and may begin with very subtle symptoms that develop gradually, or they may appear more suddenly depending on each woman's case. To understand Hashimoto's, you must first understand the role of the thyroid gland. The thyroid controls metabolism, energy production, body temperature, hair growth, skin health, mood, memory, digestion, heart function, menstrual balance, fertility, and even sleep quality. Any disruption in hormone production affects nearly every system in the body. This is why early diagnosis is crucial. Neglecting the condition allows symptoms to worsen and become more complex. Symptoms of Hashimoto's commonly appear as chronic fatigue, weight gain, or difficulty losing weight, cold intolerance, dry skin, hair loss, muscle cramps, slow heart rate, and difficulty concentrating. Mood may also be affected with symptoms of depression or anxiety that stem from hormone deficiency, not psychological causes. Some women may also experience menstrual irregularities, weak ovulation, or difficulty conceiving. While symptoms vary from one woman to another, the link between them is the gradual decline of thyroid hormone. It is important to understand that Hashimoto's is not just hypothyroidism. It's an ongoing immune process. Even if thyroid results appear within the normal range, antibodies may still be attacking the gland, meaning the disease is active. Diagnosis therefore relies on antibody testing, mainly TPO antibodies and TG antibodies. Elevated antibodies along with symptoms or mild changes in TSH provide a strong indication of early Hashimoto's. It is equally important to understand that visiting a doctor and taking a fixed dose of thyroxine is not enough to manage the condition. Hashimoto's is an immune disorder, not just a hormone deficiency. Comprehensive management requires understanding sources of inflammation, factors that activate the immune system, and lifestyle habits that worsen symptoms without you realizing it. Certain factors increase the likelihood of developing Hashimoto's or accelerating its progression, such as genetic predisposition, vitamin D deficiency, low selenium, iron deficiency, chronic stress, poor sleep, food sensitivities, chronic inflammation, and gut issues, especially leaky gut syndrome. These factors don't cause Hashimoto's on their own, but they intensify immune activation, making the condition more severe. One of the most important aspects to focus on is nutrition. There is no single diet that works for everyone, but there are general principles that help reduce inflammation and support the thyroid. Among them, reducing gluten for some women, consuming foods rich in selenium and zinc, increasing antioxidants, reducing processed sugars, and avoiding industrial seed oils that worsen inflammation. Improving gut health has a direct impact on immune balance and therefore on Hashimoto's. The gut is not just a digestive organ, it is a central immune hub. Any imbalance in the gut leads to immune imbalance, which in turn impacts the disease. Another key aspect of managing Hashimoto's is sleep. Deep, uninterrupted sleep calms the immune system, reduces inflammation, and improves cellular sensitivity to hormones. Many women with Hashimoto's struggle with sleep, which may worsen symptoms. Improving sleep patterns can make a difference significantly. Stress is another major factor that impacts the disease. Chronic stress increases cortisol levels, which negatively affects the thyroid and other hormones and increases inflammation. Stress management techniques such as deep breathing, walking, simple meditation, or any activity that soothes the nervous system are highly recommended. Regular testing is also crucial. When diagnosing or suspecting Hashimoto's, TSH alone is not enough. T3, T4, antibodies, vitamin D, iron, ferritin, B12, magnesium, and selenium should be monitored. All of these elements are linked to thyroid function, and tracking them helps identify the cause of persistent symptoms despite treatment. A comprehensive health plan helps control symptoms effectively. This includes dietary adjustments, improving sleep quality, reducing stress, supporting the thyroid with appropriate supplements under medical supervision, and regular testing. Some women notice significant improvement within months, while others need longer if the disease has been present for years. What matters is understanding, consistency, and not ignoring symptoms. It is important to clarify that Hashimoto's is not a condition that can be completely cured, but it can be controlled to a large extent. You can turn it from an active, disruptive condition into a stable one that barely affects your daily life. Many women succeed in regaining their full energy and health after understanding their bodies and adjusting their lifestyles. The disease doesn't disappear, but its activity calms down, and that is the goal. It is also important to note that weight loss may be challenging for women with Hashimoto's, not due to lack of willpower, but due to slow metabolism. Therefore, the plan must be realistic and holistic, focusing on gradually increasing metabolic rate rather than following harsh diets that increase inflammation. Hormonal imbalances associated with the condition are also common. Balancing these hormones directly improves the condition. That's why the body must be viewed as a complete system, not just a single gland. Since Hashimoto's is a long-term condition, you must be aware of signs that indicate increased activity: sudden fatigue, worsening hair loss, increased cold sensitivity, swelling, or slowed digestion. These signs mean it's time to repeat tests and adjust treatment. Knowledge is your strongest tool. Understanding your disease prevents you from falling into the cycle of unexplained symptoms. Every piece of information you learn is a step toward control. Every step toward control reduces the impact of the disease on your life.
To make your journey easier, it is essential to follow reliable sources and stay committed to learning what your body needs. Awareness is not a luxury. It is the foundation of balance. Although Hashimoto's may seem complicated, it becomes much easier when you follow a clear system based on science, symptom awareness, regular testing, and understanding your lifestyle. Your body changes over time, and treatment should change with it. Hashimoto's is a continuous journey that requires observation and adjustment. Each body is different. What works for one woman may not work for another, so avoid comparing your experience to others. What matters is listening to your body and responding to its signals. Hashimoto's progresses through different stages. In early stages, tests may appear normal while symptoms are noticeable. This subclinical stage is sensitive because the body begins to change even before diagnosis becomes clear. Persistent symptoms despite normal tests may be an early sign of immune dysfunction or declining thyroid efficiency. Symptoms should not be ignored. As the disease progresses, tests become clearer. TSH rises, and T4 and T3 may decline. Sometimes low T3 is the most impactful factor because T3 is the active hormone used by cells. Poor conversion of T4 to T3 may be the main cause of symptoms despite taking medication. Supporting the liver and gut and consuming nutrients needed for conversion can help greatly. Thyroid hormones are closely tied to reproductive health. Thyroid dysfunction affects cycle regularity, ovulation, uterine lining, and even other sex hormones. Hashimoto's may be an underlying cause of fertility struggles or recurrent miscarriage. Hormonal balance starts with thyroid balance, and monitoring tests is essential for women planning pregnancy. Adjusting thyroid treatment before and during pregnancy is crucial for maternal and fetal health. Hashimoto's also affects the nervous system. Low thyroid hormone impacts neurotransmitters such as serotonin and dopamine, leading to mood fluctuations, poor focus, forgetfulness, slower thinking, or even brain fog. Improving hormone levels restores balance and reduces these symptoms. This is not a psychological issue, it is hormone physiology. There is widespread debate today about the link between gluten and Hashimoto's. Some studies suggest that gluten may activate the immune system in certain individuals due to partial similarity between gluten proteins and thyroid tissue. This may increase antibody activity. Some women benefit from reducing or eliminating gluten for 8 weeks to observe improvement. It is not mandatory, but it can help in certain cases. Selenium is one of the most important minerals for improving Hashimoto's. It helps reduce antibodies and supports conversion of T4 to T3. It is found in Brazil nuts, eggs, fish, and some legumes. Dosages vary, so medical guidance is required. Iron deficiency, specifically low ferritin, is another major factor that worsens symptoms. Iron is essential for thyroid function and hormone conversion. Low iron contributes to hair loss, mood issues, and fatigue. Ferritin should be checked, not iron alone. Many women experience significant energy improvement once ferritin is optimized. Vitamin D is also essential. Its deficiency is extremely common among women and directly affects immunity. Raising vitamin D levels helps calm the immune system and reduce disease activity. It also plays a crucial role in energy, mental health, and bone health. This all shows that managing Hashimoto's requires a holistic view: thyroid, immune system, nutrition, gut health, sleep, stress, and lifestyle. Nothing can be isolated because the disease itself is systemic. Food quality matters. Adequate protein supports hormone production. Healthy fats such as avocado, olive oil, and coconut oil support cells and reduce inflammation. Fiber-rich vegetables improve digestion and waste elimination. Reducing sugar lowers inflammation and improves hormone sensitivity. Hydration is also important. Even mild dehydration affects energy and increases fatigue. Drinking enough water improves mood and alertness. Medication is another key factor. Thyroid hormone dosage is not fixed for life. It must be adjusted every 6 months to a year, depending on body changes. Pregnancy, stress, weight changes, aging, and sleep patterns all affect thyroid needs. Long-term reliance on one dose without follow-up is not recommended. Some women do not respond well to one type of medication. Switching brands or using a combination of T4 and T3 helps some cases. This depends on tests and the body's response. It is also important to identify personal inflammation triggers. Some women improve when avoiding dairy. Others improve with reduced caffeine. Others must address food sensitivities. The body communicates through symptoms. Listening is key. Viral or bacterial infections can increase disease activity. They heighten immune activation and antibody production. Strengthening the immune system and avoiding extreme stress is essential. Hashimoto's may also affect the heart. Low thyroid hormone can slow heart rate and raise cholesterol levels. These factors must be monitored in hypothyroidism. Digestive health is critical as well. Issues such as bloating, constipation, diarrhea, food sensitivities, or digestive discomfort are linked to thyroid function. Addressing gut health directly improves symptoms. Ultimately, health awareness is your first line of defense. A woman who understands her body, immune system, and how hormones influence her life can make better decisions and understand the root of her symptoms instead of living in confusion. Knowledge gives you control. Regular testing gives you clarity. Lifestyle alignment gives you long-term stability. To keep this awareness active and growing, you can rely on the content we provide on Women's Planet channel. Every video is designed to give you practical steps to understand your body, manage hormones, thyroid health, immunity, and overall wellness. If the information in this video helped you, subscribe to the channel, turn on notifications, and click like so you can help spread awareness to other women. Your continued engagement builds life-changing knowledge. Your presence on the channel means you are putting your health first and choosing to be an aware, informed woman who can control her body instead of being controlled by symptoms. That decision alone is the strongest step in your journey with Hashimoto's.